to Study Time, a televised home learning program produced by Rwanda Education Board.
Hello, dear students. A very warm welcome to TV learning programs or episodes. As usual, I'm your biology teacher, Herbert. Today, I will be with Senior 2 class or Form 2. And today, we are going to be having a continuation of infectious disease. I think you still remember what are infectious disease. These are diseases that can be caused by either direct or indirect contact with some of the germs or some of the microorganisms. So students, welcome to the lesson. But before we start our lesson, I would like to tell you to get a pen and a notebook. You note some essential or important words or concepts that are concerning about our lesson of today. And I would like to engage the parents to be hanging around to help some of the students to do some home assignment or activities. And where necessary, the parent can also help you to discuss with you with some of these infectious diseases because they are common to us. We know them. Let's start our lesson. Our lesson has, the lesson we are still on lesson 5, still on symptoms, prevention, control, treatment of infectious disease. So our lesson has one main objective, is to discuss about the symptoms, the prevention, and even the control of the tuberculosis and even Ebola and typhoid. So we're going to be having 3 main infectious diseases we're going to be discussing today. We're going to discuss about tuberculosis. We're going to discuss about Ebola. And you know Ebola, a very contagious disease. We're also going to discuss about typhoid. People, they do suffer from typhoid. In a neighboring country, Congo, people died because of Ebola. So we are going to discuss, and other very many African countries, people died because of Ebola. Liberia and other countries where many people died because of Ebola. So we're going to discuss the 3 major infectious diseases. So let's start the lesson. We are going to start with one of the infectious diseases, which is tuberculosis. What is tuberculosis? It is an infectious disease caused by a bacteria. And what is that name of the bacteria that causes tuberculosis? It is Mycobacterium tuberculosis. That most often affects the lungs. The tuberculosis affects the lungs. And lungs, we know that lungs are the one that used for gaseous exchange or for gas exchange. So TB or tuberculosis is spread from one person to another person through air. If you talk about through air, it means tuberculosis is airborne disease. It is airborne disease. When a person with pulmonary tuberculosis, TB, coughs or sneezes or spits a sputum somewhere, of course you can be easily suffer from that disease. They spread germs into the air. If a healthy person nearby, you are healthy, but you are living with a person who is infected. Then if a healthy person inhales, that is taking in air, these germs, they can become, you can become infected. So it is an airborne disease. People with low immune system, such as people living with HIV positive, those who are HIV positive, malnutrition people, diabetes, or people who are smokers, they have a high risk of becoming infected with TB. So tuberculosis, most of the time, it targets the groups of people who are HIV positive, who are malnutrition, people who are poorly fed, diabetic patients. We talk about people who are smokers, and even these people have a high risk of being infected with tuberculosis. So we have tried to mention the groups, and I think these are the people who are at high risk. What are the signs and symptoms of pulmonary tuberculosis? Before I start mentioning through these signs and symptoms, I would like for you to go through and read each and everything of the common symptoms of active pulmonary tuberculosis. We said one of these is caused by Mycobacterium tuberculosis. It is a bacterial disease, not a viral disease. It is caused by bacteria. And we mentioned that it is an airborne disease. Once you inhale air that has been contaminated with tuberculosis bacterium, Mycobacterium tuberculosis, this bacteria, you can be easily suffer from tuberculosis. What are the signs and symptoms? I think once you see them, you are able to go through these signs and symptoms of tuberculosis. One is what you call cough, with a sputum and blood at times. When someone coughs, the sputum must be containing blood. Once you cough and release a sputum with blood, you start to be suspecting yourself you must be suffering from pulmonary tuberculosis. There is chest pain. A person is ever having what you call chest pain. When you have some signs of having a chest pain, automatically you must be starting suspecting yourself you are suffering from TB, tuberculosis. Number 3, there is a general weakness. Person is ever weak. General weakness. Find a person is always weak. Coughing, chest pain, weak. Of course, you may start suspecting yourself to be a patient of tuberculosis, pulmonary tuberculosis. Also weight loss, or also weight. A person who drops weight from normal weight and he drops weight, that is weight loss. There's fever. There's night sweat. When you sleep at night, you have night sweat. You sweat. That is, you find yourself, you are sweating seriously during night. When a person develops active tuberculosis, the symptoms of cough, fever, night sweat, and weight loss may be mild for many months. That one could just be mild for many months and you realize that you are suffering from tuberculosis. How can you prevent or how can you treat tuberculosis? Think about the treatment and even the prevention of tuberculosis. One is isolate the patient to prevent the transmission of the disease to others, to other people. You try to isolate that patient who is suffering from tuberculosis, and also you try to not share some of the objects. Take an example, the cups, etc. So you try to isolate the person because the disease could be transmitted from one person from other person. So there is isolation of the patient to prevent the transmission of the disease to other people. Young children should be immunized. Talk about immunization. And the tuberculosis vaccine is there, it is available. That's why young children has to be immunized with BCG. And the BCG, this may prevent the spread of the tuberculosis, but the vaccine does not necessarily protect against pulmonary tuberculosis. So young children should be vaccinated. Another thing, because we said it is an airborne disease, try to avoid overcrowded places. Open windows in overcrowded rooms to allow free circulation of air. Right? Because if you try to relate this disease because we say this disease attacks the respiratory passages, the lungs, pulmonary tuberculosis, it attacks the lungs and affects the lungs. And once the lungs are affected, that one can lead to having tuberculosis. Today, students, we also have COVID also, which attacks the respiratory system. And once it attacks, it weakens the lungs, and that's most of the time you start showing the signs and symptoms of the COVID-19, but it is caused by the virus, not by bacteria. But tuberculosis is caused by the bacteria, Mycobacterium tuberculosis. Another thing that we can do to prevent, drink boiled milk. Those people who are staying in the village try to drink boiled milk, not uncooked milk. Some types of tuberculosis is transmitted from bovine. Talk about bovine hormones, and even these can just be transmitted, or can also be passed from, a cow could be suffering from tuberculosis, and you drink the milk which is unboiled of a cow that is suffering from tuberculosis, and eventually you also get affected by the tuberculosis. Another, number 5, once infected, what do you do? Tuberculosis is treated with antibiotics. Standard antibiotics of TB drugs has been used for some time, and the resist to the medicine is widespread, in other words. So you can take the antibiotics, which could be a way of. Let's talk about Ebola. When you talk about Ebola, I think it is not something new to you. It is a disease caused by a virus, not caused by bacteria. And in acute, serious illness, which usually leads to death if untreated. If you are not treated earlier, death can happen very easily. We have had very neighboring countries. I mentioned about Congo, mentioned about Liberia. These are the countries where you find people died because of Ebola. And Ebola virus is introduced into human body through a contact with a fluid of infected animals. Once these fluids from infected animals, you get in contact with them, you are likely to suffer from Ebola. These are one of these agents that can cause Ebola. We have the chimpanzee, we have gorillas, we have bats, these bats that normally feeds on fruits. We have monkeys, we have forest antelopes, and even punch pains found ill or died in the forest, and we eat them. Because, take an example, these people who are poachers, they eat these animals, and you find these animals have been affected by Ebola. So I mentioned the fluids of infected animals can cause Ebola. As I mentioned, I talked about chimpanzee, gorilla, fruit birds, monkeys, forest antelopes, and the punch pains found ill or died in forest, and you eat them. Eventually, people could be affected with Ebola. Ebola then spreads through human-to-human transmission via a direct contact. When you're in contact with a person who is suffering from Ebola, through broken skin or mucous membrane, if you are able to be in contact with the broken skin or the mucous membrane, or with the blood or secretion, organs of other bodily fluids of an infected people, and even with surfaces and even other materials that maybe, once those fluids, you are in contact with them, you are either to be suffering from Ebola. Simply, I can try to mention it very clearly that Ebola is a contagious disease. Any mucous membrane being in contact with it, person can suffer from Ebola. So medical workers to become infected while caring of the patients suffering from Ebola. So even the doctors, these medical workers, can also be infected when they are treating these Ebola patients. So when it comes to the burial ceremonies, in which mourners have to be direct in contact with the body of the dead patient, can also play a role in the transmission. When you're in contact with those bodies, that after maybe during the ceremonies of the burials, the mourners and etc., when you're in direct contact with those bodies that of a person that has been died of Ebola, you are likely also to be affected with Ebola. So people remain infectious as long as their blood the blood contains the virus. Let's have the diagram. What do you see on the diagram, student? You see some medical workers, how they are wearing. They are wearing in a way they can be in protection of that Ebola. That is an Ebola patient. So to be able to treat him, you have to be able to wear the gloves, these protected gowns. We should wear protective gauze when handling an Ebola patient. That is the diagram. You see the diagram. Once you know this is a patient of Ebola, that's how you should handle the patient. Let's go through another slide. What are the signs and symptoms of the virus? What shows that a person is suffering from Ebola? What are the symptoms of an Ebola patient? The incubation period, or the time of interval from infection with the virus to onset of the symptoms, is between 2 to 21 days. That is the incubation period. So human beings are not infectious until they develop symptoms. You can be having the signs and symptoms, but the symptoms has not been exposed out. So one of the first symptoms are sudden onset of fever, fatigue, muscle pain, headache, sore throat. These are the first symptoms that you can be able to realize that you are suffering from Ebola. Student, have you heard? I said the first symptom that you are able to realize that on the sudden onset of Ebola, that is having fever, being fatigued, muscle pain, headache, and even sore throat. This is followed by vomiting. After showing these signs and symptoms, the second sign that shows that a patient is suffering from Ebola is followed by vomiting, diarrhea, rash and even symptoms of impaired kidney and liver function. The kidney and even the liver, they are no longer functioning properly. The third is internal and external bleeding within blood oozing from the gum and ears. There's a bleeding from the gum, ears, and even the eyes. That is the third symptom. So let's have the prevention of Ebola. How can you prevent Ebola? Avoid direct contact with wild animals, like bats and even chimpanzee, because we said bats and chimpanzee are the main agents of Ebola disease. So try to avoid being in contact with these wild animals, like bats and chimpanzee. Number 2, avoid direct contact with people showing the signs of Ebola virus. 3, use gloves and other protective clothes when handling Ebola patients. Number 4, wash your hands regularly with a soap and even a clean water, as we are doing it today. Why are we washing your hands with a clean water and a soap? To avoid this pandemic of COVID-19. So also to be able to prevent Ebola, you have to be able to wash your hands regularly with a soap and even a clean water. Number 5, couples who have just recovered from the virus should abstain from sexual intercourse or use condoms. When you've been recovering from that, you should not do unprotected sex. you could have to abstain from sex, or you can use condoms. Number 6, I'm talking about in terms of prevention. Burial with these patients should be done by the health workers. So when you're going to do a burial for these people, you have to be able to. Now, another infectious disease, typhoid. Very many people are suffering from typhoid. It's a bacterial infection. It's caused by a bacteria which is called Salmonella typhi. This disease is very common to very many people, and I mentioned it in a previous lesson. We've been talking about typhoid. Taking contaminated water can cause typhoid. Taking food that has been contaminated can cause typhoid. So it is a food being contaminated or water can cause typhoid. So typhoid fever is a bacterial infection, and it is caused by a bacteria called Salmonella typhi. So which only lives in human and is related to the bacteria that causes Salmonella food poisoning. It can be spread through the body, affected and affects many organs. Without a prompt treatment, what happens? When there's no a prompt treatment, what happens? It can cause a serious complication and it can be fatal. It can be fatal, it can be dangerous. Typhoid fever, highly contagious. A small number of people are carriers. Talk about carriers, I think you remember we talked about carriers, we talked about vectors, we talked about pathogens and etc., and even carriers. So I'm mentioning that typhoid is highly contagious. A small number of people are carriers, recover from typhoid fever, but continue to have bacteria. Both ill people and carriers shed the bacteria in their feces and urine. When you shed, that's why I say that people should try to be having toilets or latrines at their homes so that they could just be able to expose, not be able to expose themselves to the typhoid. Able to have where they could just be dispose the wastes into the latrines. And even we must be having what you call a very well elaborated sewage treatment, because this sewage can also be a way how a person can be affected by typhoid. So feces and the can just be, the bacteria can just be shed off through the feces and even the urine. So the bacteria is spread by eating food or drinking water that has been contaminated with feces or urine of a patient and even carriers. So typhoid is common in areas where hygiene standards are poor. When we talk about hygiene standards are very poor, when the hygiene standards are very poor, and that one can lead into people suffering from typhoid, likely to be contaminated with sewage wastes. So areas where there is high standards or poor standards of hygiene. Take an example like sewage wastes. Dispose of these urine and even feces anywhere could be one way how people could suffer from typhoid. Let me try to show you. We have the diagram here. Try to go through that diagram. I know some of you can try to be able to allocate such a places. Take an example, like Nyabarongo down there in Nyabugogo, where water contaminated with sewage, people, they use it for home use. And eventually they suffer from typhoid. So let's have symptoms of the typhoid. There is sustainable high fever, continuous headache, feeling of being unwell, decrease of appetite, enlarged spleen and with many that may cause abdominal discomfort, dry cough in the early stage of illness, flat rose-colored rash, which may be visible on trunk, constipation or diarrhea. Constipation occurs more often than diarrhea in adults. illness varies from mild with low grade fever to severe with multiple complications. Prevention and treatment. There are a number of ways how we can prevent yourself from this typhoid. We say that typhoid is a disease caused by poor hygiene, poor standards of hygiene. So how can you just prevent it? Isolation of patients to avoid the spread of the disease by contact or by sterilizing clothes used by the patients. Food handlers in institutions like hospitals, schools, restaurants should go for regular medical checkups and treatment if found infected. Let's talk about proper disposal of feces in toilets and even in pit latrines. So proper disposal of these feces and even urine in toilets and even in the latrines. Water treatment and even purification to kill the bacteria. This water that we are using at home should be treated properly. Water treatment and even sewage treatment. This sewage has to be treated properly because they could be the agents that can cause the tuberculosis. Boiling drinking water and cooking of food properly to kill the bacteria. Another, which is number 6, practice a good hygiene methods like washing your hands proper after visiting a toilet. You wash your hands. You see, washing your hands, that one has come several times. Washing your hands, a way of preventing the disease. Washing fruits and even vegetables with a clean water before eating. Some of you eat the fruits when they are not being washed. So you have to wash the fruits before eat them. Vaccination in cases of outbreak, when there's an outbreak of the pandemic of cholera, there should be vaccination. Seek a proper treatment from a qualified medical doctor in the case of the infections so that you can get some antibiotic treatments and helps to reduce the time a person is infectious. So students, we have gone through these three infectious diseases. We talked about tuberculosis, we talked about Ebola, and even the typhoid. So students, we are ending up the lesson, but we have to test our competence. Okay? We have 3 numbers. Number 1, which disease among the following is the most contagious? Tuberculosis, Ebola, and typhoid. You go through those numbers, and I hope you will just be able to understand how this infectious disease affects our body. So students, thank you very much for your active participation. See you next time and stay safe. May God bless you.